Ladies and gentlemen, you're welcome to the channel today, and we want to have a little bit of a discussion on pregnancy. This whole channel is about pregnancy, as I said earlier, why women die when they are pregnant or are going to deliver or after delivery. So the basics for this whole lengthy discussion, that's going to take almost forever, is pregnancy. So how does pregnancy start? How does one get pregnant? Now, for a woman, before you can get pregnant, there are some things that should be in place. So first of all, you should have an ovary. So an ovary is what lays the eggs. Each person has two ovaries. So either in a month, both of them will lay the egg, or one lays this month, the other lays, and it's infrequent. It's not fixed. And it's not like alternate. This one lays this month, this one lays next month. That's not how it is. It can vary. Sometimes both of them can lay eggs. So that's how it is. So you must have an ovary that will lay eggs. If you want to, I'm talking about natural conception. If you want to go the natural way, you must have an ovary. And then secondly, for the woman, you should have a womb. So these two are very relevant, and they have to be functioning. Normal functioning ovary and womb. And then there should be the component from the male partner, which is the sperm. So good sperms, there are parameters that determine what good sperms are. So both of these, from the man and the woman, they should be functioning to be able to achieve a clinically, we say a clinically recognized pregnancy, because there are some pregnancies that are not recognized clinically, and as times go on, I will delve a little into that. So these have to be in place so that you can be pregnant. Now, for the woman, another very important system that should be functioning in you is from your, we call it hypothalamic pituitary ovarian axis. So that is what regulates your hormonal balance, as in your hormonal system. So right from your brain to your ovary, they are in coordination and in communication, and that's what brings about your cycle every month. So for you to be able to get pregnant, you must be having your cycle, like your menses, every month, or if not every month, you should be seeing blood at the end of the month, because that's an indication that one, your womb is functioning, and then your ovaries too are functioning. So if all these things are in place, then when the sperm meets the egg, there's a pregnancy that occurs, and then it comes into the womb to get established. So that is how basically in the late term pregnancy comes about. You need an egg, you need the sperm, they come together, then pregnancy, boom, comes. Right. So for this to occur, there are sometimes that abnormalities can occur for which people struggle to get pregnant. Then that will be for another discussion. But today I want to focus on, if you get pregnant, how do you know you are pregnant? How does one get to know she's pregnant? So the first thing that will happen to the woman who is pregnant is that you miss your menses. And this is well known. When you miss your menses in a reproductive age woman, or somebody who has the potential of getting pregnant, if you miss your menses, until proven otherwise, the first cause is assumed to be pregnancy. So once you miss your menses, it's an indication that you could be pregnant. Very high chance. Though there are other factors that can account for a woman missing the menses, but generally, for somebody who is in the reproductive age, usually from somewhere 15 to 45, Though there are people, the earliest pregnancy that has been recorded is 5 years. 5 years and some months. This is a long time ago, right? So with 15 years, 45 years, between these ages, normally if you miss your menses, assume there's a pregnancy. So how do you know you are pregnant? So first of all, you miss your menses, and then the next thing that a lot of people do is to test, because in the very early stages that you have missed your menses, the signs and symptoms of, or the early changes that occur in pregnancy have not started. So you won't be able to identify any signs and symptoms. So the first thing that a lot of people do when they miss their menses is to do a pregnancy test. So this is a home pregnancy test. They get the test kit, and then they use a urine. That's the commonest one. They use the urine to test for pregnancy. And I'm sure for a lot of people, we know how to interpret what a positive pregnancy test is and what a negative pregnancy test is. There are times that it may not be very clear, and those are there. But whenever you do a pregnancy test and it's not too clear, you're advised to repeat it in some days, 3 days to 1 week, to see if it can be possible. Because in the very early days of pregnancy, the specific substance that's in your urine that's making the test positive may be very low. The level may be low, so you may not be able to detect a very strong line showing that you are positive. But you can repeat it anytime, or if you are in a hurry to know, you can go to any lab, and then a blood sample, your blood will be taken to do the test, because that can detect pregnancies earlier than in the urine. Yes, because so for blood, usually after about 6 days of getting pregnant or fertilization occurring, or after 6 days of the egg meeting the sperm and then forming a baby, or forming an embryo, that's how we call it, or in the late term we say forming a baby. After about 6 days, it can be detected in your blood that you are pregnant, but your urine may not show it. So usually you know that when you miss your mens, that's about 2 weeks following, approximately 2 weeks if you have a 28-day cycle, 2 weeks following when the pregnancy occurred. So that is when you miss your menses. So usually at that time, when you do the test in the urine, you are likely to see a positive test. So this is the commonest reason people what people identify when they are pregnant. Now I have to be very categorical that a positive pregnancy test does not confirm a pregnancy. For the clinicians or for the doctors, we only confirm a pregnancy with a scan. I mean, a clinically recognized pregnancy is a pregnancy that is implanted in your womb, because pregnancies can occur in other locations. We will look at that in other videos. But pregnancies that occur in your womb is what is recognized as a pregnancy. And there are features that we look at to conclude that this is a normal pregnancy, and there are some values to it which I don't want to bother you with. But you have to always confirm the scan, the pregnancy with a scan. That is, you confirm that there is a pregnancy. The scan will also check the location of this pregnancy, and then it will look at other things that may be obvious in your womb or your reproductive organ. So it's very important, because if you don't check your pregnancy or you don't confirm with a scan, it may be that this pregnancy is probably an ectopic pregnancy, or it may be any other thing that is happening to you. So if you don't check, you're likely to delay, and if it's an ectopic, it may end up in an emergency that we may all not be happy with. So it's very important that once you miss your menses, you test positive for a pregnancy test. You have to follow it up with a scan. If you go and do a scan, and then in the early days the scanner or the sonographer tells you, or the one doing the scan tells you that I'm not seeing anything clearly, it's okay. At least you have gone to take a scan. They will reschedule you for about 10 days to 2 weeks for you to come for a repeat of the scan, at which time they will be able to see something in the womb. So I want to emphasize, it's very important that when you test positive for pregnancy, please go to any hospital go to a place where a scan is done and get a scan done to be sure that it is a correct pregnancy. Let me put it in that way. Yes, so that is very important. So this is how we get to know we are pregnant in terms of testing and then scanning. I don't want to go so much into the testing, what happened, but what is important is that you test is positive, you go and do a scan, they confirm for you that yes, you are pregnant, and they tell you how long the pregnancy has been. They can give you an estimation of when you are likely to deliver, and all those things. They can tell you if there are any abnormalities in the womb, maybe there are fibroids and other things. They will tell you about it. And in other videos, we are going to talk about pregnancies that happen in the presence of fibroids and how things go on with those pregnancies. But today, the focus of this video was to let you know how pregnancy occurs, how to confirm that there's a pregnancy, and then we'll carry on from there. I'm sure in the next video we are going to look at the symptoms that occur in pregnancy, and for this we are going to go all the way from the start of the pregnancy, that's the first trimester, to the end of the pregnancy, that's the third trimester. So keep watching the videos, educate yourselves, share for others to also enjoy, and don't forget to subscribe to the channel. I hope to see you next time. Stay blessed. Thank you.